If you're home from the hospital following a total hip replacement surgery and wondering what exercises to do, you're in the right place. Today, I'm going to show you 7 safe and effective exercises that you can do the first few days following your hip replacement surgery. Hi, my name is Cathy and I'm a physical therapist, but be sure to follow your surgeon's specific precautions following your surgery. Now, the precautions that you have will depend on whether you've had the anterior approach or the posterior approach. The things you want to avoid if you've had the anterior approach are excessive hip extension, especially when it's combined with external rotation. If you've had a posterior approach, you'll want to avoid bending your hip more than 90 degrees, internally rotating your hip, and crossing midline. These precautions are in place to reduce your risk of dislocating your new hip. Now, the goals of these exercises are to prevent complications following your hip surgery. We want to keep the circulation going so that we reduce our risk of having a blood clot or a DVT, and we want to begin gentle muscle activation. For these exercises, you'll want to do them gently and stop if you feel any pain. For all of the exercises I'm showing you today, besides the ankle pumps, you'll want to do sets of 10, and you'll want to do them 3 times throughout the day to help keep the circulation going. So the first exercise you're going to do is ankle pumps. Now, of course, you'll be lying down in your bed, but I'm just right here to show you a few of these. What you're going to do is push your feet down as if you're stepping on a gas pedal and lift them both up in the air. You're going to go nice and slow to help improve your circulation. And you're going to want to do 10 of these about every hour to help keep the blood flowing, to help prevent the vein thrombosis or a blood clot. The next exercise is a glute set. And what that is you're just going to squeeze the buttock muscles together, making sure that you don't hold your breath, and then release. Now, you'll do 10 of these, and you'll do them several times throughout the day. You're just squeezing, making sure that you're not holding your breath, and releasing. The next exercise you'll do is a quad set. So suppose I've had my right hip replaced, it's this one right here. I'm going to squeeze the muscle in the top of my leg, holding for a few seconds, making sure I maintain normal breathing, and then release. I'm going to squeeze the muscle in the top of my leg, bringing my kneecap up, and then release. You'll hold it just a few seconds and relax down. And I don't know if you can see it, but my thigh muscle here is tensing up, and that's exactly what you want. So the next exercise you'll do is a heel slide. You'll just slide your heel toward your buttock and then slide it back down. Now, if you've had the posterior approach to a hip replacement surgery, you're going to want to make sure that you keep your hip well below 90 degrees so that you don't risk a dislocation. And again, you'll do 10 of these. Now, the next exercise is called a short arc quad, or just a knee extension exercise over a bolster. You might need to have somebody help you get a little something under your leg, and then what you'll do is just tighten the muscles in the front of your thigh, holding it for a few seconds and letting it down with good control. Now, while you're doing these, again, you'd want to make sure you maintain normal breathing and slowly lower it back down. And the next exercise we're going to do is supine hip abduction. I'm going to keep my toes pointed straight up and slide my leg to the side of the bed and back to the middle. I want to be careful that I don't rotate my hips in or out, so I'm going to keep my toe pointing straight up, and we're going to go back and forth 10 times. So the last exercise I'm going to show you today is a knee extension exercise. I'm going to extend my knee and slowly let it return to the start position. You'll want to be sure to work your surgical leg when you're doing this, but if you'd like to go ahead and work your other leg, that's perfectly fine. These 7 exercises are a great way to start moving safely after your hip replacement surgery. And if you found these exercises helpful, be sure to check out this video here.